Have you ever noticed your legs feeling, I don't know, heavy, tired, or just plain achy by the end of the day?
Yeah, that end-of-day fatigue in the legs.
Exactly. Or maybe your socks leave those really obvious indentations every single night.
The telltale dents?
My neighbor, she's great, in her 70s. She put it perfectly the other day. She said, "My socks leave dents every night." And she was just sort of realizing it might be an early clue, to something bigger going on inside.
It's a common observation, definitely.
And what she was sensing, and really what so many seniors across the U.S. experience, is often the subtle start of chronic venous insufficiency, CVI for short, CVI. It's actually remarkably common. It's definitely not some kind of personal failing. It often just comes with age and, well, life's accumulated wear and tear.
That's a good way to put it, wear and tear.
But it can really impact your comfort, your mobility, and frankly, your overall quality of life. It's a big deal.
It really can be, yeah.
So in this deep dive, our mission really is to cut through the medical jargon. We want to give you a clear understanding of what CVI actually is, why it causes that persistent swelling and discomfort.
The why is so important.
Absolutely. And most importantly, we want to equip you with simple, actionable, daily habits. Things you can actually do to significantly reduce swelling and really improve your day-to-day well-being.
Practical steps.
Exactly. Practical steps, empowering you to take control and start feeling better, maybe even starting today.
It's quite remarkable, actually, how seemingly minor daily discomforts, like those sock dents you mentioned, can signal a deeper and pretty complex physiological process going on. And understanding that process, not just what's happening, but why it's happening, that's the first crucial step. It's the foundation for, truly effective, sustainable management.
So it's about reading the signs.
Exactly. Recognizing your body's subtle signals and knowing how to respond proactively, not just reacting when it gets bad.
Okay, so let's get right into it then. When we talk about chronic venous insufficiency, CVI, what exactly is happening, like fundamentally in our legs? What is this communication breakdown?
Well, at its core, CVI happens when the veins in your legs get damaged.
Damaged, okay.
And because they're damaged, they can't effectively return blood back up to your heart.
So it's a flow problem.
It's a flow problem, exactly. Instead of that smooth, efficient upward flow, gravity starts to, win the battle.
Gravity always wins, doesn't it?
It certainly tries. So this leads to blood pooling in your lower legs, especially around the ankles and feet.
Right.
And that pooling creates increased pressure inside those leg veins.
Makes sense, like a traffic jam.
Kind of, yeah. And it's really important to get that CVI isn't just one single thing. It's progressive and multifaceted.
Progressive and multifaceted. What does that mean exactly?
Progressive means it can get worse over time if you don't manage it. And multifaceted means it often involves like a mix of different vein problems working together.
Okay, got it. And when you say damage, what part of the vein are we talking about? I kind of picture veins as just simple tubes.
Yeah, that's a common picture, but they're actually much more sophisticated. Think of your veins like a plumbing system with a series of one-way doors inside. Valves.
Valves, okay.
They're designed very precisely to snap shut after blood flows through, going up towards the heart.
To stop it flowing back down.
Exactly. They defy gravity, essentially, every time your leg muscles squeeze.
Wow.
But in CVI, these crucial valves, they get compromised, damaged.
Wow.
Well, they might not close properly anymore. Maybe they're floppy, or maybe the vein itself has stretched out, become too wide.
So the doors don't meet in the middle anymore.
Precisely. They can't seal, and when that happens, gravity takes over, blood flows backward, down the leg, and pools.
That backward flow.
That's called venous reflux. And that reflux is the fundamental problem. It constantly keeps the pressure high down there, like a pump with a really leaky seal.
Okay, that makes sense. If those one-way doors aren't closing properly, blood's going the wrong way. But does this happen in all the veins in the legs? You mentioned different kinds before.
That's a really good point. It's not just one type of vein, no. This damage can happen in your deep veins.
The big ones inside the muscles.
Yeah, exactly, the major highways. Or it can happen in your superficial veins, the ones closer to the skin.
Like varicose veins.
Those are often superficial veins, yes. And it can even happen in what we call the perforating veins.
Perforating? What are those?
They're like the connecting roads linking the deep and superficial systems.
Okay, so damage can happen anywhere in that network.
Pretty much, yeah. And each type plays a role, so damage anywhere can contribute to the overall problem of CVI.
And why is it helpful for us listening to know about these different vein types? Does it change anything?
It actually does. Understanding this distinction is pretty crucial because where the damage is located can really influence the specific symptoms you feel. And importantly, it helps guide the most effective management strategies. For example, if the problem is mainly in superficial veins, you might see more varicose veins.
Right.
But if the deep veins are the main issue, you might get more significant swelling and pain.
Gotcha.
So it really highlights that multifaceted nature we mentioned. It's why treatment needs to be kind of tailored, especially for seniors who might have other things going on too.
Right.
And even if the symptoms start out mild, like just those sock dents, if CVI is left untreated, it generally does worsen over time. It can really start to interfere with your quality of life and, potentially lead to more serious complications down the road.
It's really fascinating, isn't it? Why these crucial one-way doors, these valves that work against gravity all day long, might just start to give up on us. Our sources point to several key culprits, and it sounds like it goes beyond just simple wear and tear. There are specific things that can set the stage for CVI. So what are some of those underlying reasons? Why do the valves fail?
Well, sometimes it's actually something you're born with.
Really?
Yeah. We see cases of congenital malformations, like maybe someone's born without valves in certain veins, or the valves they have are just not formed correctly.
Wow. So it's predetermined, in a way?
In some cases, yes. It predisposes them to venous issues later on. Other times, the primary changes happen within the leg veins themselves over time.
Like what?
Like the vein wall might weaken and stretch out, become too wide, and if the pipe gets too wide, the valve flaps inside just can't reach each other to close properly.
That makes sense. The structure fails.
Exactly. The physical structure prevents the valve from doing its job, allowing that backward flow, the reflux.
That's interesting about being born with it, but I imagine for many people, especially as we get older, other causes pop up later in life, right? What's the most common secondary cause you see?
Yeah, absolutely. The most common secondary cause, and this is a really significant one for a lot of people, especially seniors in the U.S., it's a history of deep vein thrombosis, DVT.
A blood clot.
Exactly. A blood clot forms in a deep vein in the leg. Now, even after that clot is treated or dissolves on its own,
It leaves damage behind.
it often does. It can leave behind scar tissue that permanently damages those delicate vein valves.
Oh, wow. Permanently.
Yeah. And this long-term consequence of DVT, we call it post-thrombotic syndrome, or PTS.
PTS, okay.
And it's surprisingly common. Something like 20% to 50%, maybe even half of people who've had a DVT will develop PTS.
Half. That's huge.
It is. And it usually shows up within 1 to 2 years after the clot. It dramatically increases their risk for developing CVI.
So if you're listening and you know you've had a DVT in the past, maybe years ago, your current leg issues, the swelling, the aching, it might actually make a lot more sense now.
It very well could, yeah.
It's not like a sign of weakness or anything. It's a real physical consequence of that earlier event.
Absolutely.
And knowing that connection can be, I imagine, a huge relief. And it's definitely something important to tell your doctor about.
Crucial information for your doctor, yes.
Okay, so valve damage is a big factor. But you also mentioned our bodies have this other incredible mechanism, right? The calf muscles.
Yeah.
Our second heart.
Yes. The calf muscle pump. It's a brilliant design.
How does it work again?
Well, every time you walk, move your foot, flex your ankle, those calf muscles squeeze the deep veins running through them.
Like squeezing a tube of toothpaste.
Exactly like that. It acts like a powerful pump, physically pushing the blood upwards, back towards your heart, directly fighting gravity.
Amazing. It works hardest when we're active then.
Precisely. And this brings us to another really important point. Even if the valves are sort of okay, maybe just a little leaky, if that calf muscle pump isn't working well, it can still significantly contribute to venous hypertension, so that high pressure.
So the pump itself can fail.
It can become inefficient, yes. And this is particularly relevant for many seniors. Think about conditions like arthritis.
Oh, right. Stiffness.
Exactly. If arthritis limits how much you can flex your ankle, if you can't get that full range of motion.
If the pump doesn't squeeze as hard?
Correct. That second heart isn't pumping as effectively, and that further impacts circulation and makes CVI symptoms worse.
So it's not just the valves, it's the whole system, the valves and the pump.
It's the whole mechanical efficiency, yes. Both need to be working well for healthy venous return.
Okay, so whether it starts with faulty valves, or maybe a weak calf pump, or often a combination.
Often a mix.
Once that blood flow is compromised and things start backing up, it triggers this whole cascade of changes deep inside the legs. You said it's not just blood pooling, it's a chain reaction. Can you walk us through what actually goes wrong internally once that process starts?
Sure. So the central mechanism, the core problem, is that persistently elevated pressure in the leg veins. We call it venous hypertension.
Hypertension, like high blood pressure, but in the veins.
Exactly. It's due to that blood pooling and the impaired return to the heart. Imagine, like you said, a leaky dam or maybe a plumbing system where the outflow pipe is partially blocked. Water keeps backing up, pressure builds against the walls. That's essentially what's happening in your leg veins, especially when you're standing or sitting for a long time.
And that high pressure isn't good for the veins, I assume.
Not at all. It acts like a constant irritant inside the veins. It actually triggers a whole cascade of inflammatory signals, like tiny alarm bells going off constantly.
Inflammation.
And these signals attract certain cells, inflammatory mediators, things that make the inside of the vein kind of sticky.
Sticky.
Yeah. So instead of being a smooth pipe, the inner lining gets roughed up, in a sense. It leads to chronic inflammation.
So the body's trying to respond, but it actually makes things worse.
In this case, the chronic inflammation contributes to the problem, yes. It starts to damage the vein lining, compromising its strength and flexibility over time.
So this isn't just temporary irritation. It's causing long-term damage to the actual vein walls. What does that look like?
Well, this ongoing inflammatory response eventually leads to physical damage and remodeling of the vein walls themselves.
Remodeling, like construction.
Sort of, but not in a good way. They can actually lose important proteins like elastin and collagen.
Aren't those the things that keep skin elastic?
Yes, and they do a similar job in veins, giving them flexibility and strength. When you lose them, it leads to fibrosis.
Scarring.
Essentially, yes. Scarring within the vein walls. This changes their thickness, makes them less flexible, less able to handle pressure.
And that leads to varicose veins.
It can directly contribute to the development of those visible bulging varicose veins, yes. The veins become less supple, more prone to stretching out.
Wow. Okay, so there's inflammation, damage to the vein walls, and this ultimately leads to the most obvious symptom for many people, the swelling. How does that happen down to the tiny blood vessel level?
Precisely. This is exactly where the swelling or edema really begins. That sustained high pressure, the venous hypertension, it doesn't just affect the big veins. It filters down to the tiniest blood vessels.
The capillaries.
The capillaries, yeah. And the small venules, they start to stretch out, dilate, become kind of twisty and leaky.
Leaky capillaries.
Yes. We call it endothelial dysfunction. Basically, the lining of these tiny vessels gets damaged and fluid starts to leak out into the surrounding tissues.
Just water?
Not just water. Fluid, but also red blood cells, proteins like fibrin, stuff that shouldn't normally be outside the vessels.
Fibrin, like in blood clots.
Related, yes.
Yeah.
And this leaking fibrin can actually start to form these tiny cuffs around the capillaries.
Cuffs? Like little straitjackets?
Kind of. Imagine tiny internal bandages, but instead of helping healing, these fibrin cuffs actually block the exchange of oxygen and nutrients between the blood and the tissue cells.
So the tissue starts to starve?
Effectively, yes, it gets deprived. And that, combined with the chronic inflammation caused by all the leakage, that's what really contributes deeply to the persistent, noticeable swelling and discomfort you feel, especially in the lower legs and ankles.
Wow. It's a complex process.
It is. The damage at the micro level, those leaky capillaries and fibrin cuffs, directly translates to the macro symptoms we see and feel, like the swelling and skin changes.
Okay, so we've unpacked what CVI is doing inside our legs, but what does this communication breakdown, this internal cascade, what does it actually feel like day to day? How does your body signal that something's not right? Especially as we get older. For many seniors, it often starts subtly, right? With a few key sensations or visible signs that might just creep up over time. A really common one, and I've definitely felt this after a long day on my feet, is that feeling of heaviness or fullness in the legs.
Yeah, that heavy dragging feeling.
Exactly. Often described as aching or just feeling like your legs are perpetually tired.
Leg fatigue.
And it typically gets worse after you've been standing or sitting for a long time, which makes total sense now thinking about that blood pooling.
Right, gravity at work.
But the good news, often, is that it feels much better when you just rest and, importantly, elevate your legs.
Elevation brings relief, yeah.
So that heavy, aching, swollen feeling is incredibly familiar to a lot of people living with CVI.
And a key insight here really is that the swelling itself, the edema, as doctors call it, in the lower legs and ankles. That's truly a hallmark symptom of CVI.
The main clue, often.
Often, yes. And it's particularly noticeable after you've been upright for a while or just at the end of the day, and it's usually a specific type of swelling. We call it pitting edema.
Pitting. What does that mean?
It means if you press gently on the swollen area with your finger, it leaves a little indentation, a temporary pit that slowly fills back in.
Like memory foam, but in your leg.
Kind of, yeah. And that pitting is a direct result of that excess fluid leaking out from the capillaries and accumulating in the tissue spaces.
So my neighbors comment, my socks leave dents every night.
That's a perfect classic example of early pitting edema. Those dents are the pits.
Wow, okay. And if that severe swelling just keeps going on untreated?
Well, unfortunately, that can lead to scar tissue developing within those swollen tissues, fibrosis.
Or scarring.
Yeah. And it can make the calf feel kind of large and hard to the touch. And that hardening, unfortunately, makes the skin much more vulnerable to breaking down and developing those persistent ulcers we need to avoid. The skin's health gets really compromised.
Okay, so heaviness, aching, pitting edema. What else might someone feel?
Well, beyond the swelling and aching, you might also feel other sensory discomforts. Things like burning, tingling, or that pins and needles sensation in your legs.
Like your leg fell asleep, but it keeps happening.
Sort of, yeah. And leg cramps, especially at night, are also a very common complaint. They can really disrupt sleep and make you feel tired the next day.
Night cramps.
Yeah. And another thing is skin irritation. You might notice itchy, flaking, or just really dry skin on your lower legs and feet.
Itchy skin, why does that happen?
It's another sign that the skin's health and its protective barrier are being compromised by that underlying pressure and inflammation. It definitely needs attention.
And then there are the things you can see, right? The veins themselves.
Absolutely. Many people notice dilated, visible, sometimes bulging or blue twisty veins. Those are varicose veins.
Right.
Or you might see smaller clusters of red or blue lines, like little spider webs, spider veins.
So if you see varicose veins, does that automatically mean you have CVI?
Not automatically, no, but they are a strong indicator that there's some underlying blood flow problem. There's pressure building up somewhere. And those problems could certainly worsen over time and develop into full-blown CVI. So they're definitely a sign to watch.
Yeah.
Hashtag tag 2.2, visible signs and skin changes as CVI progresses.
Okay, so as CVI progresses, those internal changes, the fluid leakage, the chronic inflammation, they start to show up more dramatically on the outside, right? On the skin.
That's right. The skin, especially around the ankles and lower legs, gives us some pretty clear visual cues that things are getting more serious.
So what should we be looking for specifically as visible signs that CVI might be progressing?
One of the most characteristic signs, and it's quite concerning when you see it, is a reddish-brown discoloration of the skin.
Reddish-brown?
Particularly on the inner lower leg or near the ankles. That area just above the inner ankle bone is a common spot.
And why does it turn that color?
It happens because that sustained high venous pressure forces red blood cells to actually leak out of the tiny capillaries into the surrounding tissue.
Red blood cells escaping.
Yes. Extravasation is the technical term.
Yeah.
And as these red blood cells break down in the tissue, they leave behind their iron pigment. It's called hemosiderin.
Iron. Like rust.
It looks a bit like rust staining, yeah. That hemosiderin literally stains the skin from the inside out.
Wow.
And over time, this pigmentation can darken, sometimes becoming almost black. It's often a permanent mark of chronic, long-standing venous issues.
So that color change is literally leftover iron from leaked blood cells.
Yeah.
That's a really powerful visual, isn't it? Of the damage happening underneath. Like the skin is telling a story.
It really is. And the visual changes can become even more pronounced. With that chronic venous hypertension, the skin itself can become thickened and hardened.
Hardened skin.
Yeah. Due to fibrosis, more scarring, but this time in the subcutaneous fat layer, just beneath the skin. It gives the skin a kind of a leathery look and feel.
Leathery skin. What's that called?
Clinically, we call it lipodermatosclerosis. Leukodermatosclerosis.
Okay. That sounds serious.
It indicates pretty advanced changes. And in really advanced stages, this progressive contraction of the skin and the tissues underneath can actually cause the lower leg to shrink in circumference.
Shrink.
Yeah. Sometimes resulting in a shape that looks like an inverted champagne bottle or kind of stick-like right above the ankle, especially if there's still swelling in the calf above that constricted area.
Wow, that's a stark image.
It's a very stark visual indicator of long-standing, severe, untreated venous disease. And beyond this hardening, the chronic inflammation can also lead to skin rashes.
Rashes. like eczema.
Exactly. It's often called venous dermatitis or stasis eczema. It might look like dry, scaly patches or sometimes even little blisters that weep fluid.
Weeping skin.
Yeah. And these skin changes, the discoloration, the hardening, the eczema, they're not just cosmetic issues at all. They significantly weaken the skin's integrity, its ability to act as a barrier.
Making it prone to breaking down.
Exactly, much more prone to injury and infection, and ultimately making it a very vulnerable area for developing those difficult-to-heal venous ulcers. Hashtag tag 2.3 key risk factors for seniors in the U.S.
Okay, so who is most likely to end up dealing with CVI? Especially thinking about our senior listeners here in the U.S. We know it can affect anyone, but are there factors that really bump up someone's risk, make them more vulnerable?
Oh, absolutely. There are several well-established risk factors, and a key one, maybe the most significant, is simply advanced age.
Having older.
Yeah, CVI typically affects people over age 50, and the risk definitely increases significantly with each decade after that.
Why is age such a big factor?
Well, it's often due to natural age-related degenerative changes. The smooth muscle in the vein walls can weaken and atrophy over time.
So they get less strong,
less elastic, more susceptible to stretching out to dilation. And the valves themselves can also degenerate and just not work as well after decades of use. The aging process itself makes the whole venous system a bit less resilient to pressure.
Okay, age is a big one. What else? This next one seems huge for modern life. Prolonged standing or sitting.
Yes, that's a major contributor, absolutely, to both developing CVI and making existing symptoms worse.
How does that work?
Occupations or lifestyles that require you to be immobile for long periods, whether you're standing in one spot for hours like a cashier or a factory worker, or sitting at a desk or driving for hours,
Right.
It directly hinders blood flow. Your calf muscle pump isn't getting activated.
The second heart is switched off.
Pretty much. Think about those long flights or car rides. Your legs feel like logs when you finally stand up, right?
Oh, yeah.
That heavy, swollen feeling, that's blood pooling because the pump wasn't working. Your body's telling you it needs that pump turned back on.
Makes sense. What about weight?
Obesity, or carrying excess weight, is another major risk factor.
How does extra weight affect the veins?
It puts additional physical pressure on the veins in your abdomen and legs, and that constant extra pressure can damage the valves over time, making it harder for blood to flow efficiently back up.
So managing weight is important.
Maintaining a healthy weight is surely one of the most effective things you can do to prevent CVI, or manage it if you already have it. It significantly reduces that mechanical strain on your whole venous system.
Okay. And you mentioned DVT earlier.
Yes, and it bears repeating because it's so significant. A history of deep vein thrombosis, a past blood clot.
Is the most common cause of secondary CVI.
It is. The clot damages the valves, often permanently. So people with that history face a significantly higher risk of developing CVI, usually in the form of that post-thrombotic syndrome, PTS.
So if you've had a DVT, you really need to be proactive about vein health.
Absolutely critical. Proactive monitoring, careful management. It's essential to minimize future complications.
What about genetics? Does it run in families?
It often does, yes. There seems to be a hereditary component. If you have a family history of varicose veins or other venous problems, your personal risk is increased.
So you can't change your genes.
No, you can't change your genes. But knowing that risk factor exists can empower you, right?
Yeah.
To be more proactive with lifestyle changes, maybe get checked out earlier if you notice symptoms.
Good point. Knowledge is power.
Yeah.
And you mentioned arthritis earlier too.
Yeah.
Limiting ankle movement.
Right. If conditions like arthritis significantly limit your ankle flexion, how much you can bend your foot up and down.
It weakens the calf bump.
Exactly. It impacts circulation and contributes to that venous hypertension. So range of motion in the ankle really does matter for your circulation.
Interesting. Are there any other factors?
A few others, yeah. Being female tends to increase risk.
Why is that?
It's thought to be related to hormonal factors, and also the physical stresses of pregnancy put a lot of pressure on leg veins. Also, just having existing varicose veins already puts you at higher risk for progression to CVI, and smoking and tobacco use are also risk factors.
How does smoking affect veins?
Smoking damages blood vessels in general, makes blood thicker, contributes to inflammation, all things that are bad news for vein health over time.
Okay, so we've got a good handle on what CVI is, what it feels like, what it looks like, and who's most at risk. But let's talk about the stakes. What happens if CVI is just left unchecked, ignored? Because it seems like beyond the physical symptoms we've talked about, it can really start to impact how you live your life day to day, especially for older adults. This isn't just about, minor discomfort anymore, is it?
No, not at all. It really shifts into impacting life quality in a major way. Hashtag 3.1 impact on quality of life.
It's absolutely true. If we look at the bigger picture, the overall impact, that persistent discomfort, the aching, the pain, the physical limitations from swelling, it can lead to a significant reduction in your mobility.
Makes it harder to get around, much harder. And that directly affects your independence, your ability to do the things you enjoy, whether that's, walking the dog, gardening, playing with grandkids, visiting friends, even just doing your grocery shopping.
Yeah, things you take for granted.
Exactly. But it's not just physical. We really have to acknowledge the mental health toll, too.
How so?
Living with chronic vein problems, the constant awareness of it, the discomfort, it can lead to anxiety. Low self-esteem, especially if there are visible changes like varicose veins or skin discoloration that make people feel self-conscious.
Right, worrying about how it looks.
Yeah, and even depression can set in, stemming from those lifestyle limitations and the burden of chronic pain. It really can significantly impair the quality of life for people affected. It can turn what should be enjoyable, active retirement years into a real struggle with discomfort and frustration. Hashtag 3.2 serious complications if ignored.
And if it's left unaddressed, CDI isn't just a nuisance that makes your socks leave dents or keeps you from walking as far. It's a progressive disease. And it can lead to some truly serious complications that impact your health far beyond just swollen ankles. These are the real stakes we need to understand.
Yes. And the most severe manifestation, the one that absolutely requires urgent attention, is the development of venous stasis ulcers.
Ulcers.
Open sores.
Open sores on the skin, yes. Usually appearing near the ankles, particularly on that inner ankle bone area, the medial malleolus.
Are they painful?
They are often painful, especially if they get infected. And the big problem is they do not heal easily.
Why not?
Because the underlying circulatory problem, the high pressure and poor nutrient exchange, prevents the tissue from repairing itself properly.
And infection is a risk.
A very high risk. These open wounds are incredibly prone to infection. And that infection can spread to the nearby tissue, causing cellulitis, a serious skin infection.
Cellulitis.
And if that's left untreated, the bacteria can potentially get into the bloodstream and cause sepsis. Sepsis. That's life-threatening.
It absolutely can be. So the presence of a venous ulcer is a very clear signal of advanced unmanaged CVI. It's a situation that needs immediate specialized wound care and treatment of the underlying vein problem.
Okay. Ulcers are a major concern. What else? You mentioned DVT earlier as a cause of CVI. Can CVI also lead to more DVTs?
Yes, unfortunately it can. Here's where it becomes really critical. CVI, by altering blood flow in the legs, making it sluggish and turbulent.
Creates conditions for clots to form.
Exactly. It increases the likelihood of blood clots forming in those deep veins. Another DVT.
And if those clots break loose?
If a DVT breaks free and travels through the bloodstream up to the lungs, it can cause a pulmonary embolism, a PE.
Which is a blockage in the lung.
Yes, and a PE is a life-threatening medical emergency. It requires immediate attention. This connection between CVI, DVT, and PE is a critical point everyone needs to understand.
Wow. So the vein problems themselves can set you up for potentially fatal clots.
It's a serious potential complication, yes. And this brings us to a really crucial point. While CVI itself, in the early stages, isn't usually immediately life-threatening, these complications certainly can be. The Centers for Disease Control and Prevention, the CDC, estimates that as many as 100,000 Americans die each year from DVT and PE.
100,000 people? That's a shocking number.
It's a stark reality. And it really underscores why proactive management of CVI and early intervention are just so critically important, particularly for seniors who are already at a higher baseline risk for blood clots.
Okay. Ulcers, DVT, PE, are there other physical complications?
Yes, a couple of others are worth mentioning. Untreated venous insufficiency can sometimes lead to hemorrhage or bleeding.
Bleeding from where?
From those fragile, thin-walled varicose veins near the surface. If they get bumped or scratched, they can bleed quite profusely. It can be alarming and in rare instances, even life-threatening if not controlled quickly.
Wow, didn't think about that.
And another thing is that progressive subcutaneous scarring, that lipodermatosclerosis we talked about.
The leathery skin.
Yeah, if it extends deep into the tissues around the ankle joint, it can actually restrict movement, lead to ankle joint stiffness, even a condition called fixed plantar flexion, where your foot gets stuck pointing downwards.
Seriously limiting mobility.
Very seriously, further limiting mobility and independence.
And all this pain, swelling, stiffness, it naturally leaves people to be less active, right?
Understandably so, yes. The chronic leg pain and swelling associated with CVI can really limit mobility, leading to a much more sedentary lifestyle.
And we know being sedentary is bad for overall health.
Exactly. We know that reduced physical activity is a major contributor to a whole host of other significant health issues: obesity, diabetes, cardiovascular disease.
Which can then make the CVI worse, potentially. A vicious cycle.
It can become a vicious cycle, yes. And these other conditions, of course, impact overall health and can potentially shorten life expectancy. It's all interconnected.
It really highlights how managing the CVI isn't just about the legs.
Precisely. The World Health Organization, the WHO, has strongly emphasized that lack of physical activity is directly linked to serious health problems like heart disease, diabetes, stroke, some cancers. Looking at the overall impact by treating vein disease, by relieving symptoms like leg pain and swelling.
You enable people to be more active.
Exactly. Vein care helps restore mobility. It empowers patients to stay active, break that negative cycle, and improve their overall health and well-being. Hashtag 3.3 CVI and life expectancy. So after hearing about all these potential complications, ulcers, infections, sepsis, DVT, PE, reduced mobility contributing to other diseases, you might be wondering, okay, what does this actually mean for life expectancy?
Yeah, that's the big question, isn't it?
Well, by itself, venous insufficiency, CVI, is generally not classified as a directly life-threatening condition. It's not like having a heart attack, for example.
Okay, that's somewhat reassuring.
However, as we've just discussed in detail, it can significantly affect your quality of life. Massively. And it absolutely can contribute to other serious health risks that may indirectly impact longevity.
Through those complications.
Exactly. Through complications like DVT, PE, and sepsis from infected ulcers. It's the cascade of untreated issues, the downstream effects that pose the real, albeit indirect, threat to your long-term health and potentially lifespan.
Okay. But the good news here, and this is what we really want to focus on for the rest of our conversation,
yes,
is that this isn't inevitable. With the right daily habits, the things we're about to dive into, and with guidance from a specialist if needed, you can absolutely take control of your symptoms.
You absolutely can.
You can significantly reduce the risk of these serious complications and just feel much, much better day to day.
That's the key message. Management is possible and effective.
So catching it early, being proactive, managing it consistently, it's truly a gift you give to your future self.
Well said. It's about choosing a path towards a more comfortable, healthier, and yes, potentially longer future.
All right, let's get practical. We've talked a lot about the problems, now let's talk solutions. You want your legs to feel lighter, right? Look healthier. Let you do the things you love without that constant discomfort nagging at you.
That's the goal.
And the really great news is, you don't need to suddenly join a gym or buy a load of fancy gadgets to start making a difference.
No, simple steps are often the most effective.
Exactly. What you need is a simple plan, something you can actually stick with. Think daily rhythm, think small, consistent wins.
Consistency is key.
I've seen this work firsthand with my neighbor, the one I mentioned earlier, in her 70s. She started super small, just 5 minutes of movement here and there.
Building it up gradually.
Yeah, and now she walks her dog twice a day. And she swears her evening swelling is literally half of what it used to be. It made a huge difference for her.
That's fantastic. It shows it's possible.
It absolutely is. You can do this too, step by step. No perfection needed, okay? Just consistent effort. So let's start with what I like to call movement snacks.
Movement snacks, I like that.
Yeah. It's all about integrating activity into your day in these small, manageable bursts, not feeling like you have to block out an hour for a workout. You know?
Makes it less intimidating.
Totally. And a great place to begin is with simple ankle pumps.
The classic ankle pump. Essential.
Right. Every waking hour, if you can remember, maybe set a little reminder, aim to just point and flex each ankle 10 times.
Point your toes down, pull them up.
Exactly. Or you can roll your ankles in gentle circles too. Think of it like you're gently pumping a gas pedal. This super simple action directly fires up your calf pump, that second heart, and actively helps lower the pressure in your leg veins, getting that blood moving upwards.
It's surprisingly effective for such a small movement.
Isn't it? Okay, beyond that, aim for maybe 2 short walks a day.
Short walks, okay.
Yeah, we're not talking marathons here. Even just 5 to 10 minutes after breakfast and maybe again after dinner can make a significant difference.
Frequency over duration sometimes.
That's the goal here, yeah. Frequent motion, not necessarily distance records. And hey, if your balance is a concern, that's okay. Use a hallway wall for support. Hold on to a sturdy chair.
Safety first?
Absolutely. Focus on short steps, but try to get a good heel-to-toe roll as you walk. That really maximizes the calf pump squeeze.
Good point. Heel to toe.
And to make movement just a natural part of your day, try creating movement cues.
Cues, like reminders.
Yeah, linking movement to things you already do. Like if you watch TV, make the commercials your cue. Stand up, march in place for 30 seconds, maybe a minute.
Ah, okay. Use the ad breaks.
Right. Or if you enjoy reading, set a timer on your phone or stove for every, say, 20 or 30 minutes. When it goes off, get up, walk around the room, do some ankle pumps.
Break up that sitting time.
Exactly. Because your veins respond much better to that kind of rhythm, that consistent, gentle motion, than they do to like one big heroic workout once a week, followed by days of sitting.
Consistency beats intensity here.
That's it. Consistent small efforts are absolutely key.
And it's quite remarkable, isn't it, how even these small, seemingly minor, consistent movements are directly fighting that venous stasis, that pooling, and the hypertension.
Yeah.
Every single time your calf muscle contracts, it's actively pushing blood back towards the heart. It's directly reducing the pooling and the pressure that lead to the swelling and discomfort.
You're literally activating your body's own pump.
You're leveraging your body's natural second heart to improve circulation. And that consistent, gentle pumping action prevents the blood from just sitting there, stagnating, which is a primary driver of all the CVI symptoms. It's an internal, natural mechanism that we can consciously switch on through these simple daily actions.
Okay, next up, elevation. Sounds almost too simple, right? Just putting your feet up.
Simple, but incredibly effective. Don't underestimate it.
Why is it so good for reducing that end-of-day swelling?
Well, when your feet are up, higher than your heart, the pressure inside your leg veins naturally plummets.
Because gravity starts helping for once.
Exactly. You're letting gravity assist the blood flow back towards your heart instead of fighting against it. It helps drain that pooled fluid.
Okay, but how high do they need to be? Is just propping them on a coffee table enough?
Probably not, to be honest. The key is aiming for your ankles to be just above the level of your heart.
Above the heart, okay.
So yeah, a couple of pillows on the couch often aren't quite enough to get that proper angle.
So what works better?
A good reclining chair where you can really lean back and get your feet up high.
Yeah.
Or lying down on a couch or bed and putting your calves up on a firm cushion or a stack of pillows. You want proper, effective elevation.
Gotcha. And how often should you do it?
Try to make it a regular practice. Aim for maybe 10 to 15 minutes, a couple of times a day.
Like in the afternoon maybe?
Yeah.
And again in the evening?
That's perfect. If
Yeah.
you take a nap, elevate while you nap. If you read or watch TV before bed, elevate then.
Build it into the routine.
Exactly. These small, consistent sessions, they really add up over the course of a week. They make a noticeable difference in managing that fluid retention and providing real, tangible relief.
So you might actually feel the swelling go down.
You often can, yes. And it's this simple act, elevating your legs, that dramatically reduces what we call the hydrostatic pressure in your lower extremities.
Hydrostatic pressure, the fluid pressure.
Right. By raising your legs above your heart, you're creating that helpful downhill gradient, helping drain that pooled fluid back into your circulation where it belongs.
And you mentioned earlier, if you wake up and your ankles look less swollen than when you went to bed.
That's a clear, immediate signal. It shows that the system is effectively unloading that excess fluid overnight while you're lying flat.
So sleep helps too.
Sleep is natural elevation, yes. It directly addresses that core issue of blood pooling and pressure, offering relief that you can often both see and feel each morning. It reinforces that elevation works.
Okay, let's talk about compression. Stockings, socks. This seems like a really common recommendation for CVI.
It is. Compression therapy can truly be a game changer for many people when it's the right fit and used correctly.
But honest truth here, sometimes they can feel weird, right? Or be hard to put on.
They definitely can, especially at first. And I promise you, a good fit makes all the difference. So please don't give up if the first pair you try feels odd or uncomfortable. It might just not be the right size or pressure for you.
Okay, good point. Don't give up easily. So why is compression so important? What does it actually do?
Well, it's profoundly important because it provides external support to your vein walls. It gently squeezes the leg.
Helping the veins do their job.
Exactly. It helps ease the swelling and the discomfort, partly by preventing fluid from leaking out so much, and partly by helping your veins work better, improving that upward flow. It basically gives your veins some backup.
What kind are usually recommended? There seem to be lots of types.
Providers most commonly recommend graduated compression stockings.
Graduated? What does that mean?
It means they're designed to be tightest down at the ankle, and then the pressure gradually decreases as they go further up your leg.
So it encourages upward flow.
Precisely. It helps push the blood back towards the heart. For many people with venous insufficiency, knee-high stockings are often sufficient.
Knee highs, okay.
Oh.
And what about the pressure level? I see numbers like G.
Right, millimeters of mercury. That's the pressure measurement. A common starting range for CVI is often 15 to 20 millimilli Hg, or maybe 20 to 30 millimilli Hg, but your doctor will recommend the right pressure for you.
Okay. And when should you wear them? All day?
Generally, yes. The best practice is to put them on first thing in the morning.
Why first thing?
Because that's usually when swelling is at its lowest, before gravity has had a chance to make things pool downstairs, so you put them on before the swelling builds up.
Makes sense. And wear them all day?
Typically, yes. You wear them throughout the day while you're up and about, and then you generally take them off before you go to sleep.
Take them off for sleep. Okay.
Unless your clinician gives you specific instructions otherwise. Sometimes, for certain conditions like active ulcers, they might recommend wearing some form of compression at night too, but that's a specific medical decision. Always follow your provider's advice. And this brings us to a really crucial point. While compression is incredibly beneficial for many, it's not universally suitable for absolutely everyone.
Oh, we shouldn't use it.
Well, it's absolutely essential to get medical guidance first. From your doctor or a specialist, they need to assess you properly.
To make sure it's safe.
Exactly. Proper fitting is one thing, but more importantly, they need to ensure it's safe for you. This is especially critical if you have significant peripheral artery disease, PAD.
Poor circulation in the arteries.
Right. If the arteries bringing blood down to your legs are already narrowed, putting tight compression on top could actually restrict blood flow further and be dangerous.
Okay, that's really important. PAD is a contraindication.
A major one, yes. Also, people with severe neuropathy, nerve damage where they can't feel their feet properly, need to be very cautious.
Because they might not feel if the stocking is causing a problem.
Precisely. Or if you have very fragile, thin skin, the wrong compression could potentially cause skin breakdown.
So, bottom line. Talk to your doctor first.
Absolutely paramount. Get their okay, get properly measured, and follow their exact guidance on the type of compression, the pressure level, the MNHG, and exactly when and how to wear it. Because as you said, ill-fitting or inappropriate compression can actually worsen your condition. It can impede blood flow in the wrong places or create harmful pressure points.
And just to echo that again, a proper fitting by someone trained can make them feel so much better and obviously work more effectively.
Huge difference.
And I've learned a few tricks for getting them on too, because they can be tight. A donning sleeve, which is like a slippery sock you put on first.
Those can help a lot, yeah.
Or even just using simple rubber kitchen gloves. They give you a much better grip on the fabric without snagging it, making them much easier to pull up.
Yeah.
Especially helpful if you have arthritis or less hand strength.
Great tip. Little things like that can really make a difference in sticking with it consistently, which is the goal.
Okay, let's shift gears a bit. What about what we put into our bodies? Does diet and hydration play a role in managing CVI and swelling?
Oh, a huge role. Often underestimated, I think. What you eat and drink has a direct impact on your vascular health, including your veins, and can definitely influence how much swelling you experience.
So it's not just about compression and elevation.
Not at all. Think of it as fueling healthy veins from the inside out. And we're not talking about needing to follow some perfect, super restrictive diet. It's more about making practical, sustainable shifts.
Okay, let's start with hydration. Just drinking enough water.
Absolutely essential. Maintaining proper hydration is crucial for healthy veins and just good overall vascular health.
How does water help veins?
Well, drinking enough water daily helps keep your blood flowing smoothly. It affects blood volume and viscosity, how thick or thin your blood is.
So dehydration makes blood thicker.
It can, yes, making it harder for your heart and veins to pump efficiently. Good hydration also helps prevent constipation.
Constipation. What does that have to do with leg veins?
It's a connection many people miss. Straining during bowel movements significantly increases the pressure inside your abdomen.
Okay.
And that increased abdominal pressure directly translates to increased pressure in your leg veins, making pooling and swelling worse. So staying hydrated and eating fiber helps keep things moving regularly, avoiding that strain.
Wow, okay. Didn't realize that connection.
Yeah. And finally, proper hydration actually helps your body regulate fluid balance better, potentially reducing water retention in your lower extremities. Your veins and your skin, they both need adequate hydration to function at their best.
Okay, so drinking water is important. But I know a lot of older adults worry about drinking too much because, more trips to the bathroom.
That's a very common concern, yeah.
Is there a risk of overdoing it?
Well, it's important to understand that your body's fluid regulation isn't like a simple sponge, where more water in automatically means more swelling out. It's much more intricate.
Right.
Adequate hydration is crucial for that blood volume and flow we talked about. Too little water can actually hinder circulation.
So not drinking enough could almost backfire.
It can. The goal is balance. Having a small water bottle nearby and just sipping throughout the day can be a gentle nudge. Of course, the important caveat here is if your doctor has specifically told you to limit fluids.
Right, like for heart failure or kidney problems.
Exactly. In those cases, you absolutely must follow your doctor's specific fluid restriction plan. But for most people, staying adequately hydrated is beneficial for vein health.
Okay. Now, what about food? Are there vein superfoods we should focus on?
There definitely are foods that are particularly supportive of vein health. A good general rule is to aim for lots of color on your plate.
Eat the rainbow.
Basically, yes. Think about flavonoid-rich foods. Flavonoids are powerful plant compounds.
Where do we find those?
Berries, blueberries, strawberries, blackberries, citrus fruits like oranges and grapefruits, apples, onions, even dark chocolate in moderation.
Dark chocolate. I like the sound of that.
Yeah. These flavonoids act as potent antioxidants. They help reduce inflammation throughout the body, including in the blood vessels. They can strengthen the vessel walls and even enhance blood flow. They're truly beneficial.
Okay. Berries, citrus, apples, onions. What else? You mentioned fiber for constipation.
Yes, high-fiber foods are crucial, again, for supporting digestive health and preventing that constipation-related pressure increase.
So things like
whole grains, oats, brown rice, whole wheat bread legumes like beans and lentils, fruits, and plenty of vegetables. These keep your digestive system running smoothly.
Got it. Fiber is key. Any specific vitamins or nutrients?
Yeah, a few others are important. Vitamin C is great because it supports collagen production.
Collagen, like foreskin.
Yes, and it's also essential for strong, elastic vein walls. So, oranges, kiwi, bell peppers, broccoli, good sources of vitamin C. Vitamin E is another good antioxidant found in things like spinach, almonds, sunflower seeds.
Okay, C and E for vein wall strength.
Right. And omega-3 fatty acids are fantastic for reducing inflammation and promoting smooth blood circulation.
Fish oil.
Fatty fish like salmon and mackerel are great sources. Also, flax seeds, chia seeds, walnuts.
Good fat.
And one more, potassium. Potassium-rich foods help your body regulate fluid balance and can actually help reduce water retention.
Oh, interesting. So that directly fights swelling.
Yeah.
Where do we get potassium?
Sweet potatoes are excellent. Also, soybeans, bananas, spinach, peaches, leafy greens.
Lots of healthy choices there. Okay, so those are the foods to include. What about foods to limit or avoid if you're dealing with swelling?
Yes, avoiding certain foods is honestly just as important as choosing the right ones when it comes to managing CVI swelling. The biggest culprit?
Salt.
Sodium, absolutely. High sodium foods are notorious for causing fluid retention.
How does that work?
Sodium essentially makes your body hold on to more water to try and maintain a specific concentration balance. And that excess retained fluid significantly worsens leg swelling, increases venous pressure, and just makes you feel more uncomfortable.
So where is sodium hiding? It's not just the salt shaker, right?
Oh, definitely not. It's packed into processed foods. Think processed snacks like chips and crackers, canned soups, frozen meals, deli meats, sauces. Reading labels is really key here.
Think less ultra-processed salt bombs. Got it. What else besides salt?
Refined carbohydrates and excess sugar are also problematic.
White bread, pastries, candy, soda.
Exactly. These can contribute to weight gain, which we know increases pressure. They also promote inflammation throughout the body and generally lead to poor vascular health. Not good for your veins.
Okay, limit sugar and refined carbs. What about fats?
Trans fats, the artificial ones often found in processed baked goods and fried foods, should definitely be avoided as they damage blood vessels. And excessive saturated fats found in fatty meats and full-fat dairy can also contribute to poor circulation and inflammation if consumed in large amounts. Aim for those healthier omega-3s instead.
Makes sense. And underlying all of this dietary advice
is maintaining a healthy weight. We keep coming back to it because it's so fundamental.
Yeah.
That excess weight just places constant additional pressure on your legs and veins. It increases the likelihood of developing CVI in the first place, or it makes existing symptoms significantly worse.
So working with your doctor or maybe a dietitian.
Yeah, finding a healthy, manageable weight management plan that works for you is a cornerstone of managing CVI effectively.
Okay, let's talk about skincare. This might seem less obvious,
Right.
but you mentioned earlier how the skin gets affected. Why is taking care of the skin on your lower legs so important with CVI?
It matters far more than most people realize, honestly. That high pressure inside the lower leg, the venous hypertension, it really takes a toll on the skin.
How so?
It disrupts the normal delivery of oxygen and nutrients, and it causes that fluid leakage we talked about. This makes the skin incredibly dry, often thin, and much weaker. Its natural protective barrier gets compromised.
So it's more vulnerable.
Extremely vulnerable, and that's why even small nicks, scrapes, or bug bites, things that might be minor annoyances for someone else,
Can become big problems with CVI.
Exactly. They can be slow to heal, easily get infected, and potentially even develop into those chronic venous ulcers we desperately want to prevent. So protecting that fragile skin is absolutely vital.
Okay, so what does a good daily skincare routine look like for someone with CVI?
It doesn't have to be complicated, but it needs to be consistent. First, wash your legs gently every day.
Hot water.
No, lukewarm water is better. Hot water can be drying. Use a mild soap, nothing harsh or heavily perfumed.
Okay, gentle washing. Then what?
Pat the skin dry gently with a soft towel. Don't rub vigorously, especially if the skin feels fragile.
Pat dry. Got it.
And then the crucial step, moisturize. Every single day, especially after bathing while the skin is still slightly damp to lock in moisture.
What kind of moisturizer? Does it matter?
Yes, it does. Use a plain, thick, fragrance-free cream or ointment. Things like petroleum jelly or creams specifically designed for very dry, sensitive skin are often good choices. Avoid lotions with perfumes or alcohol, as they can be irritating.
So thick, plain, fragrance-free. Apply it all over the lower legs.
Focus on the lower legs and feet, yeah. This daily moisturizing helps keep the skin hydrated, supple, and reinforces that protective barrier.
Okay, that seems doable. What else should people watch out for with their skin?
Well, this brings us back to that crucial point. Why is this diligent skincare so critical? It's because, as we've established, that leakage of fluid and red blood cells makes the skin fragile, prone to flaking, cracking, itching,
And infection.
and much more susceptible to infection. Good skin hygiene, including that daily moisturizing, helps prevent these breakdowns. It actively protects against ulcer formation. You're not just making your skin feel better, you're actively safeguarding your body's first line of defense in a very vulnerable area.
Okay. What if the skin is already showing changes, like that brownish discoloration, or if it's really itchy?
If you see that rusty brown discoloration, the hemosiderin staining, and especially if it's itchy, it's really important to avoid scratching.
Easier said than done sometimes.
I know, but scratching can easily break that fragile skin. Keep your fingernails trimmed short and filed smooth to minimize accidental damage.
Good tip. Keep nails short.
And if you have diabetes on top of CVI, checking your feet and lower legs every single day is absolutely essential. Look for any cuts, blisters, redness, warmth, anything unusual.
Daily foot checks for diabetics.
That's cool. Critical. And for anyone with CVI, diabetic or not, if you notice any new signs of potential problems like increased redness, warmth in one area, any drainage or pus, or a sore that isn't healing, call your clinician right away.
Don't wait.
Do not wait. Early treatment of even a small skin breakdown can prevent months of difficult wound care and stop a small issue from becoming a major ulcer.
I remember you mentioned a friend with a flashlight.
Yeah, my friend who had diabetes and CVI made it a nightly ritual, kept a small flashlight by his bed, and quickly checked his heels and ankles before sleep. Sounds simple, maybe a bit obsessive,
But effective.
but that consistent habit probably saved him from countless problems, potentially months of serious wound care. It's those little proactive steps. Hashtag tag 4.6 footwear and clothing choices.
Okay, what about things we wear? Do shoes and clothes make a difference with CVI?
They definitely can, yes. Think of your footwear as a quiet helper in managing CVI.
A helper? How so?
Choose shoes that have flexible soles, shoes that allow your ankle to bend and move freely as you walk.
Why is flexibility important?
Because Remember that ankle bend? That natural motion? That's calf pump gold.
Ah, it helps the second heart work.
Exactly. It directly supports the function of your calf pump and helps propel blood upwards.
So stiff shoes are bad.
Stiff-soled shoes, or really heavy boots, can significantly impede that natural ankle flexion. They effectively limit the calf pump's efficiency.
So what kind of shoe is generally recommended?
Supportive shoes are good, but aim for ones with a relatively low heel and that flexibility in the sole. They allow for better calf muscle engagement when you walk.
Okay, flexible soles, low heels. What about standing for long periods, like cooking?
Ah, good question. If you find yourself standing in one spot, like at the kitchen sink or stove, try using a soft anti-fatigue mat on the floor.
Do those really work?
They can help cushion, yeah. And while you're standing there, make a conscious effort to shift your weight from heel to toe every few minutes, or just do some gentle calf raises.
Keep the pump working subtly.
Exactly. Those little movements truly help reduce that evening swelling because they keep that crucial calf muscle pump gently activated.
Okay. What about clothing? Anything to avoid?
Yes. Avoid clothing that's really tight or has constricting bands, especially around your waist, groin, or legs.
Like tight belts or girdles. Or tight elastic on socks.
Exactly. Anything that digs in and potentially restricts blood flow can increase pressure lower down in your veins and hinder proper circulation. Comfort and freedom of movement are key. Loose or comfortably fitting clothing is generally better. Hashtag tag 4.7, travel smart.
Travel. That's a big one for leg swelling, isn't it? Sitting in a car or plane for hours.
Oh yeah. Travel can be particularly tough on your veins because of that prolonged immobility. But a few simple habits can make a huge difference in managing swelling and preventing potential complications like DVT.
Okay, let's start with car rides. Long drives.
For long car trips, the key is to break it up. Plan to stop every hour or two, if possible.
Get out and stretch your legs.
Yes. Get out, walk around for a few minutes, and even before you step out of the car and right after you sit back down, do maybe 5 or 10 quick ankle pumps.
Get the blood moving again.
Exactly. Reactivate that calf pump immediately before and after the period of sitting still.
Good tip. What about flying? Planes seem even worse sometimes.
Flying can be challenging, yeah. That combination of sitting still, cramped space, and lower cabin pressure.
So what can you do on a plane?
If you can, choose an aisle seat when you book. That makes it easier to get up and move around without disturbing others.
Okay, aisle seat. Then what?
While you're seated, make it a point to regularly do those ankle circles and ankle pumps. Just keep your feet moving periodically.
Wiggle your toes.
Wiggle your toes, flex your feet, roll your ankles, anything to keep the circulation going in your lower legs. And whenever the seatbelt sign is off and it's safe to do so, stand up. Take a quick walk up and down the aisle.
Even a short walk helps.
Absolutely. Just changing position and getting the muscles working helps.
What about compression stockings for travel?
Definitely wear your compression stockings on travel days, if your clinician agrees they're safe for you. They provide that crucial external support against the effects of sitting and pressure changes. It's probably one of the most effective things you can do when flying.
Okay, wear the stockings. Anything else for flights?
One more small tip. Pack a little tube of moisturizer in your carry-on.
For your legs, why?
Because the air inside airplane cabins is incredibly dry. It can really dry out your skin, making it feel tight and itchy, especially if it's already fragile from CVI. A quick application of moisturizer can help keep it comfortable. Hashtag tag 4.8, mindset and consistency.
Okay, we've covered a lot of ground with these daily habits. Movement, elevation, compression, diet, skincare, footwear, travel. It might feel like a lot to remember.
It can seem like a list, yeah.
So let me try to finish this section with maybe a simpler rhythm you can remember. Something like, move often, elevate daily, moisturize your skin, get compression fitted with guidance, eat colorful, fiber-rich meals, keep your shoes flexible, plan smart for travel.
That's a great summary. Hits all the key points.
Because none of this is about being perfect, right? Or completely overhauling your life overnight. It's really about stacking these small, consistent habits that protect your veins and your skin over the long haul.
Exactly.
And I've honestly watched many older adults, like my neighbor, truly turn a corner by focusing on these basics. They start feeling significantly better, more in control, and just much more comfortable in their own skin. It's achievable.
And looking at the overall impact, the mindset piece is huge. Consistency. Not striving for unattainable perfection is absolutely the key.
Consistency over perfection, I like that.
These small anchors you build into your day, the ankle pumps while watching TV, the elevation before bed, the quick moisturizer application, They truly make a big difference over months and years. It's the compounding effect.
Yeah. And maybe tracking progress helps.
Oh, definitely. Tracking your progress, even in a really simple way. Maybe just jotting down a line in a notebook each day about how your legs felt.
Like less achy today, or sock dents seem shallower?
Exactly. Or noting if your shoes fit easier at the end of the day. Or maybe you realized you walked an extra block without discomfort. Those little observations can powerfully reinforce the positive behaviors.
Because you see it's actually working.
Precisely. Progress feels much bigger and more motivating when you can actually see it written down or notice those small improvements. It offers both encouragement and tangible evidence that your efforts are paying off.
And the big message here, I think, is that you can absolutely live well with CVI.
Many, many people do. It's manageable.
Right. Nothing about having chronic venous insufficiency should automatically keep you from finding joy in life. Wear the shorts if you want to. Take that stroll in the park.
Don't let it define you or limit you unnecessarily.
Exactly. You are not behind or failing. You are right on time.
Yeah.
You're learning how your body works now, maybe differently than before, and learning how to care for it with knowledge and confidence. And that itself is powerful.
Very powerful. Taking charge.
These small daily actions are truly an investment in your future comfort, your mobility, and your overall well-being. Okay, so we've spent a lot of time on these simple, powerful daily habits, and they really are the first line of defense for managing CVI.
Foundational, absolutely.
But there are definitely times when these habits alone aren't enough, or when you need to bring in the professionals.
Yes, medical guidance is crucial in many cases.
So, knowing when to call your clinician for an assessment, and maybe even more importantly, knowing when something might be a real emergency, that's crucial for your health and honestly for your peace of mind too. Hashtag tag 5.1, when to call your clinician, non-emergency.
This brings us to a really important question. Okay, when should you seek professional medical help for your leg symptoms?
Right, when is it time to make that call?
Well, if symptoms like persistent leg pain, swelling that doesn't improve, that feeling of heaviness, or maybe the appearance of new varicose veins, if these things persist, or especially if they seem to be getting worse despite you really trying your best with these lifestyle changes.
Like elevation, movement, watching salt.
Yeah, if you're doing those things consistently and still struggling or getting worse, it's definitely time to consult a doctor, preferably a vein specialist if possible.
Okay. Worsening symptoms despite trying. What else?
Also, just call your provider if you have any new or changing symptoms that worry you, anything different from your usual pattern. Or, importantly, if you're using compression stockings and they just don't feel right.
Like if they're painful or too loose.
Exactly. Remember, an ill-fitting stocking can actually worsen your condition by creating pressure points or not providing effective support. So getting that fit checked and adjusted is really vital. Don't just suffer through uncomfortable compression.
Good point. And when you see the doctor, should you ask for specific tests? You mentioned ultrasound earlier.
Yes. Don't hesitate to ask about getting a duplex ultrasound of your leg veins, especially if the swelling, skin changes, or pain are persistent or unexplained.
Duplex ultrasound, what does that do again?
It's a painless, non-invasive test. It uses sound waves to create a picture, like a map, of your veins.
What can they see on the map?
They can check the direction of blood flow, specifically looking for that backward flow, the reflux, across the valves. They can measure how bad the reflux is. They can also screen for any hidden blood clots, like a DVT.
So it gives a really clear picture of what's going on.
An incredibly useful picture, yes. It helps confirm the diagnosis, pinpoint where the problems are, and guide the most appropriate treatment. It's essential for keeping you safe and making sure the treatment plan is right.
And this isn't just random guesswork by doctors, right? There are guidelines.
Oh, yes. There are clear, established clinical guidelines that doctors in the U.S. follow to decide when an ultrasound is needed, how to interpret it, and what treatments are indicated based on the findings.
Okay. And when you're there, it's also a good time to ask practical questions, right?
Absolutely. Be proactive. Ask about specific skin moisturizers they recommend for your skin type. Ask them to confirm the exact strength and type of compression stocking that makes sense for you.
Get personalized advice.
Exactly. Your medical team is there to partner with you. Ask questions. Make sure you understand the plan. Hashtag tag 5.2 red flags. Go to the ER immediately.
Okay. Now for a really critical safety check. We need to talk about red flags. Situations where you should not just call your doctor's office for an appointment next week. Situations where you need immediate medical attention, like go to the ER or call 911.
Yes, these are absolutely crucial to recognize. potential emergencies.
What's the biggest one related to the legs themselves?
If one leg, usually just one, not both, suddenly swells up significantly, feels unusually warm to the touch, and becomes painful or tender, especially deep in the calf.
Sudden, one-sided swelling, warmth, pain.
Yes, that combination could be a sign of a serious, deep vein thrombosis, a DVT, a new blood clot, and that needs urgent medical evaluation and treatment to prevent it from breaking loose.
Okay, DVT symptoms, urgent care. What's the even more critical emergency?
Even more critically, if you experience sudden chest pain or sudden unexplained shortness of breath.
Chest pain, can't breathe.
Especially if it's accompanied by any of those leg symptoms we just mentioned, but even without them, this could signal a pulmonary embolism, a PV.
The clot traveled to the lungs.
Potentially, yes.
Yeah.
And a PE is a life-threatening medical emergency that requires immediate intervention. There's no waiting with those symptoms.
So, just to be crystal clear, sudden chest pain, sudden shortness of breath.
Call 911 or get to the nearest emergency room immediately.
Right. If that's you or someone you're with, don't hesitate. Don't wait to see if it gets better. Tell a flight attendant if you're flying. Pull the car over safely. Call your local emergency number right away. Trust your gut.
Absolutely. When it comes to potential DVT or PE symptoms, it is always better to be safe than sorry. Get checked out immediately. Hashtag 5.3, understanding medical interventions. Brief overview.
Okay, so assuming it's not an emergency, but the daily habits and maybe compression just aren't quite cutting it, or if your CVI is more advanced,
Yeah.
your clinician does have other tools available, right? More medical interventions.
Yes, absolutely. If lifestyle changes and compression aren't providing enough relief, or if the underlying vein damage is significant, there are other effective treatments. It's important to see these not usually as replacements for the daily habits, but as things that complement them when necessary, by addressing the underlying faulty veins more directly.
Okay. What kind of things are we talking about? Medications?
Sometimes medications play a role, yeah. For instance, if you develop a skin infection or an ulcer related to CVI, you'll likely need antibiotics to clear that up.
Makes sense.
Or if you have DVT or are at high risk for one, you'll need anticoagulants, blood thinners to treat the existing clot and prevent new ones from forming.
Right, blood thinners for clots.
Yeah.
Any other medications?
Sometimes for ulcers, special medicated wraps might be used, like something called an Unaboot. It provides compression and medication directly to the wound. There are also some emerging drugs called vasoprotective agents.
Protecting vessels.
Yeah, things like hydroxyethyl rudoside or pycnogenol, which is a pine bark extract. Some studies suggest they might help improve symptoms like pain and edema in CVI.
Are they commonly used?
They're used more in some parts of the world than others. They show promise, but often more research is needed, and they're usually considered in specific situations, often alongside other treatments, not typically a first-line therapy on their own.
Okay, so meds are part of it sometimes. What about procedures? Things to fix the veins?
Yes, there are several procedures, ranging from minimally invasive to more traditional surgery. Many are done right in the doctor's office or as an outpatient.
Like what?
Well, for spider veins or smaller varicose veins, something called sclerotherapy is common.
Sclerotherapy?
Yeah, they inject a special solution, either a liquid or a foam, directly into the problem vein. This irritates the vein lining and causes it to collapse and seal shut. Blood then reroutes through healthier veins nearby.
Okay, injection to close small veins. What about bigger varicose veins?
For larger superficial veins, like the main saphenous vein if it's refluxing, a common approach now is endovenous thermal ablation.
Thermal ablation.
Heat. Exactly. Endovenous means inside the vein. They insert a thin catheter into the diseased vein, then using either laser energy or high-frequency radio waves delivered through the catheter tip, they generate intense heat.
To basically cook the vein shut.
Essentially, yes. The heat seals the vein closed from the inside. Again, blood reroutes naturally. These are generally very effective, minimally invasive procedures with quick recovery.
Okay, heat ablation for bigger veins. Are there still surgical options, like vein stripping?
Surgery is usually reserved for more severe or complex cases these days, but yes, it still has a role. Ligation and stripping involve surgically tying off, ligating, and removing stripping the main problem, superficial vein, usually the saphenous vein.
That sounds more involved.
It is a bit more invasive than ablation, yeah. Another surgical technique is microincision phlebectomy.
Phlebectomy.
That's used to remove bulging varicose veins through tiny little incisions, almost like punctures. The veins are pulled out in segments, often done alongside ablation or stripping.
Okay, and what about those perforator veins you mentioned? The connectors?
If the perforator veins are identified as a major source of the problem, especially with ulcers, there's a minimally invasive procedure called SIP-ACE subfascial endoscopic perforator surgery. They use a small camera and instruments to go under the fascia, the tissue layer covering the muscles, and clip those faulty perforators.
No, quite targeted.
Very targeted, yeah. And finally, for very, very severe cases, often involving blockages in the deep veins, vein bypass surgery might be considered. Similar to heart bypass, but in the leg, but that's usually a last resort.
Okay, lots of options. Is recovery tough for these?
Actually, for many of the modern procedures, especially ablation and sclerotherapy, recovery is usually quite fast. People are often up and walking the same day. Walking is actually encouraged to promote circulation. For surgery like stripping, recovery might take a bit longer. And what's really fascinating here is how tailored these interventions can be. Doctors can often combine techniques to address the specific pattern of vein disease in each individual patient.
Right, because CVI is multifaceted.
Exactly. The goal is always to identify and address the underlying sources of that high pressure, those damaged veins, and redirect the blood flow through healthier vessels nearby. That's how you relieve symptoms and prevent progression.
But it sounds crucial to really understand what's being recommended and why.
Absolutely critical. If your clinician suggests a procedure, you need to ask questions. Don't be shy. Ask. What specific problem is this procedure going to solve for me? What happens if I choose to wait? What does the recovery really look like? Pain, time off work, activity restrictions? And importantly, how does this option fit with my other health conditions and my personal goals for treatment?
Good questions to ask.
Yes, a good medical team will welcome your questions. They should explain the rationale, the risks, the benefits, the alternatives, all in plain language you can understand. You need to feel like a fully informed and empowered partner in making decisions about your care. #tag outro.
Okay, wow. We have really taken a deep dive today into chronic venous insufficiency. We've unpacked its causes, looked at the whole range of symptoms from annoying sock dents to serious ulcers, and discussed the very real impact it can have on your life.
We covered a lot of ground.
We did. But I think the biggest takeaway, the most hopeful message, especially for our senior listeners, is that CVI is a manageable condition. You are not powerless here. You have significant agency in feeling better and improving your daily comfort.
Absolutely. Looking at the overall impact and the evidence, the integration of these simple, consistent daily habits we discussed, that regular movement, the strategic elevation, appropriate compression, always with medical guidance, mindful eating, diligent skincare, that whole package is truly foundational.
They're not just minor tweaks.
Not at all. These are powerful, evidence-based strategies. They can significantly reduce swelling, alleviate that aching and discomfort, prevent complications, and profoundly improve your overall quality of life. It's about empowering you to take control of your venous health step by step, day by day.
And remember my neighbor, the one in her 70s.
Yeah, the one who's swelling halved.
Exactly. Her small, consistent actions, the short walks, remembering to elevate, they genuinely transformed her evenings, improved her sleep, let her enjoy her days more. That's the real power of these habits in action. Small habits really do compound over time.
They absolutely do.
And if you need more help, targeted treatment exists. Procedures are available if lifestyle changes aren't enough. So please hear this. You are not behind. You haven't failed if you have CVI. You are right on time right now to learn and to act to help your legs feel better this month and next month and for years to come. You absolutely deserve care that respects your goals and helps you live fully and comfortably.
And this brings us maybe to a final thought, a crucial point for reflection. Your body is constantly communicating with you. What is your body trying to tell you through these symptoms? Maybe the swelling, the aching, the skin changes, and how will you choose to respond?
Listening to your body.
Yeah. Because your body isn't just a passive sponge simply soaking up fluid when things go wrong. It's this incredibly dynamic, intricate system that truly thrives on balance and rhythm. And by understanding and honoring that rhythm through things like regular movement, periods of elevation, good hydration, the right fuel, through implementing these daily habits we talked about, you're not just managing a condition.
You're doing more than that.
You're actively investing in your future self. You're reclaiming your vitality, taking powerful, deliberate steps towards a more comfortable, more mobile, and ultimately more joyful life.
That's a great way to frame it. It's an active investment. So take control. Embrace these simple, powerful daily habits. Start small, be consistent, and please, don't hesitate to talk to your doctor. Ask those questions. Ask about getting that duplex ultrasound if things aren't improving. Work with them to build a personalized plan, one that respects your goals and helps you thrive. You've got options, and you've got support out there.
Help is available.
Absolutely. Thank you so much for joining us on this deep dive today.
My pleasure.
Until next time, keep learning, keep moving, and keep feeling your best.